focus on the lower limb and the pelvic girdle. So we're going to begin with the pelvic girdle. And I'm just going to kind of show you the general layout here, and then we'll start to look at the bones up close and see how they are put together. So your pelvis is made up of 3 separate pieces. Okay, at the back here we have the sacrum, which is part of the axial skeleton, the end of the spinal column. And then we have 2 great big wide bones that make up the pelvis proper, known as the os coxa. Okay, and os coxa literally just translates to hip bone. So we're going to focus on those os coxa to begin with and look at their different features and the 3 bones that embryologically come together to make them. Talk a little bit about the pubic symphysis there in the middle, how this thing is actually arranged, and then we will move on down the leg. All right, now I will say for this one, some of these bones are a lot larger than what we've seen in the previous videos, so I may have to do some kind of maneuvering of the camera or just look at certain pieces at a time. This is one of your os coxa, okay? Remember, os coxa is hip bone. This makes up the side and front of your pelvis. Here at the back of this bone, we have a rough patch. That is where it actually articulates with the sacrum, and that forms what's called the sacroiliac or SI joint. Okay, sacroiliac joint, the iliac part refers to the ilium, which is this big flat bone that makes up kind of the bowl of your pelvis. Okay, that is one of the 3 embryological bones that comes together to make the os coxa. Okay, so this thing kind of sits like this. Let me tilt this up a little bit here. Kind of sits like this. It's actually tilted forward quite a bit, kind of at that angle right there. So this whole piece is the ilium. Here along the ilium we see the iliac crest, which is not something you need to identify for lab, but it's going to help us kind of understand some of the muscle attachments later on. Okay, so that is the ilium. The other 2 bones are the pubis, which wraps around to the front to make the pubic arch, and then the ischium, which is the bottom piece down here, which is very thick. Okay, there's a bump there called the ischial tuberosity. That is a point for muscle attachment, and it's also kind of like what you sit down on. Okay, so nice and thick and heavy duty there. Okay, so if we look at this from the side, we notice the very obvious socket for the hip. That is the acetabulum. And of course, that's where your femur head is going to go in and articulate to form another ball and socket joint. Okay? But your acetabulum is actually made up of pieces of all 3 of the bones of the os coxa. You're not going to have to identify them in here. It'll just be like, what's this one, what's this one, what's this one. Okay, so ilium, pubis, and ischium down here. This, all you'll have to know is that it's the acetabulum. Okay? So the other feature on here that we want to talk about is this big hole. That big hole is called the obturator foramen. And it basically serves to kind of lighten the pelvis and also allows for passage of a series of nerves and blood vessels out into the leg. Okay, so I'm going to actually show you all an articulated pelvis here. Okay, that is this guy. So we can see our SI joints back here. Those are fibrous joints. They're not supposed to move, okay, because then you would compromise the stability of the hips and your spinal column. The only mobile portion of the entire pelvis is supposed to be right here, and that is the pubic symphysis. Okay, symphysis joints are made up of fibrocartilage, so this thing is basically made of the same stuff that our intervertebral discs are. Okay, so it sits just like this. In your book, your lab book, there's like a line here that it asks you to label. That's called the pubic angle. And that's just kind of a diagnostic feature in terms of like determining male or female from skeletal remains. The male pubic angle is generally less than 90 degrees. The female pubic angle is more than 90 degrees, which creates a wider opening for birth. Okay, so this is a male pelvis. I don't have the female one right in front of me, but that part's not really all that important. Okay, so that is your pelvic girdle. Okay, ilium, ischium, pubis here, making the pubic symphysis. The acetabulum is the hip socket, and then the obturator foramen right there is the big hole. Okay? So that takes us to our femur, which is the largest bone in the body, largest single bone in the body, and one that you will definitely have to be able to determine left or right on. Okay, so let me try and get a little bit better view of this. We can get it all in frame there. So we're gonna, almost threw it off the table. We're gonna start with the proximal end of the femur, the head. And of course, this is where the head of the femur fits into the acetabulum. So there's your acetabulum, there's the femur head, nice ball and socket joint, okay? So the femur head, there's a little indentation there called the fovea capitis, which we talked about in class. Not anything you're gonna have to identify, but it's basically an attachment point for a ligament that holds this thing into the socket. Below the head of the femur, you have the neck, okay, this narrow area. Okay, that is commonly where the femur might break in cases of like osteoporosis or like elderly individuals. If they fall, that's typically where it breaks. That's also where if you have to have a hip replacement, they just like saw the head off and drill a hole and they put the implant in that way. Okay, and if you're in my Thursday lab and you were present, you heard my story about hip replacements. Okay, below the neck, we see two bumps. Okay, one high up and to the outside above the neck, one lower down below it and to the inside. Those are called trochanters. Okay, so just like tuberosities and tubercles and all that other stuff, trochanters are just big points for muscle attachment. Okay, the one that is above the neck and to the outside of the femur is called the greater trochanter. And the greater trochanter is an attachment point for a number of different muscles, including things like the gluteus medius and the iliopsoas. Okay? Down here, the lesser trochanter on the medial side of the femur and below the neck. Okay? If we flip this over and look, you can see the connecting groove, that's called the intertrochanteric line, which we don't really need to worry about, okay? Greater trochanter, lesser trochanter, they are more visible from the backside. You can see them from the front. So on the test, you'll probably be expected to label them from the back simply because it's easier to see them that way, okay? So if we look at the shaft of the femur, the diaphysis, the front of the femur is nice and rounded and smooth, okay? If we look at the back, there is a sharp ridge that runs down the middle here. That ridge is not on your word list, but it's called the linea aspera, and it is the point of attachment for a big band of connective tissue called the IT band or fascia latae. And we'll be seeing that when we get into the muscles here in a couple of weeks. Okay, but basically your gluteus maximus and then a number of other muscles kind of wrap around and insert on that line to flex the femur backwards. Okay, but that's one of the ways you can tell that you're looking at the back of it. If you can see that ridge, it's upside down. Okay, front of it is nice and smooth. So now we go down to the distal end, okay, at the knee, and we see our two femur condyles. Okay, the lateral condyle is on the outside, okay, the side away from the head down there. The medial condyle down here is on the side with the head. You can see them a little more clearly if we flip this over. Okay, between the two condyles, we have a big indentation. Okay, that's called the intercondylar fossa. Not something that's on our word list. You're not going to be tested about it, but we're going to see what it's there for here in just a second. Okay, so that's your femur. In terms of determining left or right, it basically works the opposite of the way the humerus did. Okay, remember the humerus, you could tell whether it's upside down or not by whether the distal end was curving towards you or away from you. With the femur, if it is face up, the shaft will be off the table, okay? Because unlike the humerus, because your elbow bends forward, your knee bends backwards. And so the distal end of this is curved backwards to allow for the hinge joint with the tibia to bend the knee backwards. So if it's sitting flush like that and there's space underneath it, you're looking at the front of it. If it's upside down, the shaft is going to be on the table and the condyles are curved up towards you. Okay? So that is the femur. The femur forms a joint with the tibia. Okay? This is the tibia. Okay? Another very large bone. This is your shin bone. Okay? The top of the tibia has two fossa. Okay? These are also called the tibial condyles, but really they're fossa. Okay? They're indentations. And that is where your femur condyles go in and articulate. So notice that between the tibial fossa, okay, and basically the femur condyles, you see that bump, okay? We don't need to know this. This is called the intercondylar eminence, but it fits into the intercondylar fossa just like that. That helps with tracking of the knee. That eminence is also the source of your two cruciate ligaments. The ACL comes from the front, PCL comes from the back. Both of those insert into this intercondylar fossa to keep the knee connected in the center there, okay? Now, if you're looking at the front of the tibia, just below the tibial head, you're gonna see a bump, okay? That bump is called the tibial tuberosity. It is also a point for muscle attachment. More specifically, it's the point for attachment for the patellar ligament, which in turn connects to the quadriceps muscle group via the quadriceps tendon. So let's go ahead and look at the patella real quick. I'm just going to kind of set these down so we can sort of see how they connect with each other. And obviously you would not want your knee to be bent this much because that would hurt. This is your patella, okay? Patella looks like this. All you need to know about this is that it is the patella, okay? That's your kneecap, and it sits right there, okay? I actually am not 100% sure this patella goes with this knee. I think this is a left femur, and I think this is a right patella, but doesn't really matter. Sits in there like that, okay? So your quadriceps muscle group is the big group of muscles on your thigh up here, and it's going to extend down to the patella via the quadriceps tendon. The patella then connects to the tibial tuberosity via the patellar ligament, okay? When your quadriceps muscle contracts, it pulls up on the patella, which then pulls forward on the tibia. So your patella basically acts as a pulley across that joint. So that's going to allow you to stand up, push yourself up from a squat, kick a soccer ball, things like that. Okay, that's what your quadriceps muscle group does, is extend the leg at the knee. Okay, and it does so via the patella, which helps that tendon track across that joint and keeps everything aligned. If your knee is at like maximum flexion, like I can't really show it to the camera, but if it's like as far as it goes there, your patella is going to protect that tendon and keep it from fraying across the front of the tibia or the front of the femur down there. Okay, so this is a left tibia. The tibia works a little bit opposite what the femur does. Okay, the front of it, you can see the tibial tuberosity, and there is a sharp ridge. Okay, that's the anterior tibial crest. On one side of that ridge is a muscle called the tibialis anterior. It is to the outside, okay, for here. And then on the other side, there is nothing, okay? There is a band of connective tissue. There's a membrane over the bone called the periosteum, and then there's just skin, okay? So I had a question in lab the other day about shin splints. For one thing, you can feel this bone, okay, towards the inside. That's just straight up bone there on your shin. There's no muscle on the front of it, on the medial side here, which is why you have to wear like shin guards playing soccer and stuff like that. But shin splints is basically the movement of the group of muscles around here rubbing across that periosteum, and it causes irritation of the bone itself. Which is why you can't just like take Tylenol or put ice on it and make it go away. It's actually inflammation of the bone and the periosteal membrane. Okay, now down here, we see something kind of similar to what we saw with the wrist, with the radius and ulna. We see a big bump. That bump is called the medial malleolus, okay, medial malleolus. That is the bump on the inside of your ankle, okay? Big, thick piece of bone. That kind of determines the range of motion for inversion of the ankle, which is inward rotation of the foot, and protects the ankle and keeps it aligned there. Okay, so we can see down here, that would be your articulation with the ankle bone, the talus, which is on top of your foot, and this piece kind of keeps it aligned right there. Okay, so we're going to come back to the tibia in just a moment. I want to show you the other bone of your lower leg, which is the fibula. Okay, so tibia, great big thick bone. Fibula, really thin skinny bone. Okay, we mentioned this in class, but if you had to put all of your weight through one of these, it's going to be the big one, not the skinny one. The fibula is not actually a load-bearing bone at the knee. Okay, so let me grab, I've got an articulated set over here. Okay, so if you look at it, your fibula does not even connect to the femur, okay? The femur sits up here. Your fibula's head actually articulates with the tibia below that joint, so it's not load-bearing through this portion of the bone. And you wouldn't really want it to be because it's really thin and skinny, okay? What the fibula really does is brace the outside of the ankle, okay? So we'll come back to it in a second. In terms of what you need to know for the fibula, this is the proximal head. It's kind of thick and has a point on it. The distal end here is flatter. That is the lateral malleolus. Okay, so this thing kind of sits just like this, okay, on our tibia and forms the outside of the ankle. So you can also feel that on yourself. That's the kind of bump on the outside of your ankle. And essentially those two bones come together to frame your talus, which is your ankle bone. So here's your medial malleolus, got to be pointed towards the inside. There is your lateral malleolus on the outside. So notice your lateral malleolus extends downwards a lot further than the medial does, which is why you can invert your ankle a lot further than you can evert your ankle out the other way. Most of the time, if people break their ankle, it is this bone that gets broken because it is very thin through there. It's not nearly as strong as the tibia is. Okay, so you're more likely to break your ankle by everting it too far than by rolling it to the inside, okay, because it does have more range of motion there. Okay, so these two bones held together by an interosseous membrane, which we'll be talking about in the lecture class, just keeps them together. One of the cool things about your fibula is that you can technically live without pieces of it because all its work is really done down here, not up here in the shaft. So a few minutes ago, I'll just go ahead and tell you all this because we did talk about it in class for those of you who were not here. If we look at the head of the femur, okay, that indentation right there, that fovea capitis, there's a blood vessel that goes in here as well and feeds the bone cells in the femur head. There is a condition called avascular necrosis where for one reason or another that blood vessel stops working and the femur head begins to lose its blood supply. The problem with necrosis is that necrosis spreads, okay? When cells begin to die due to a lack of nutrients, it kind of corrupts the cells around them and they begin to die too. And if you let that continue in the head of the femur, the whole thing will disintegrate, which would necessitate a hip replacement. So one of the possible treatments to prevent that and stop the necrosis is they will actually drill out, okay, a segment of bone here, the necrotic tissue, and then they will go in and cut out a little section of the fibula, okay, somewhere up here where it's not load-bearing, and then basically just like tap it in there with a hammer to reseed it with healthy bone tissue, and in some cases that can actually repair the necrosis and replace that bone tissue with stuff that actually works. Okay, it's just one way to prevent having to have hip replacement surgery, which comes with its own kind of host of issues. All right, now that brings us to the foot, right? And we're gonna look at this foot that is articulated just to get a better understanding of how this whole thing works, and also because I don't have one that's not articulated. The foot is very similar in layout to what we saw with the hand, okay? These bones at the base, okay, your ankle and the ball of your foot, those are called tarsals instead of the carpals that are up here in your wrist, okay? So these are tarsals. The difference here is that you have to know the name of two of these tarsals, whereas with the carpals, we just call them carpals. Okay, the two we need to know are the talus, the ankle bone, and the calcaneus, the heel bone. Okay, talus, calcaneus. The other five through here, if you see a pin in the middle of all this and it just says name this group of bones, those are just tarsals. Okay, the talus and calcaneus are really interesting. Tilt this down a little bit so we can see it a little better. The talus is really well designed to spread your weight distribution forward into the toes and back into the heel, and also spread it side to side 50-50. Okay, that allows humans to stand on 2 feet for a very long time versus like other animals that have 4 legs. Okay, so really, really interesting design here, very effective design. Okay, what that design relies on is the maintenance of the foot arch. Okay, there is a band of connective tissue that runs from this hook on the backside or the underside of the calcaneus to the hooks at the heads here of your metatarsals, flat band of connective tissue on the bottom of your foot called the plantar fascia. Plantar fascia maintains the shape of the arch, both forward and back and from side to side, to help promote perfect weight distribution. So if you have flat feet, or you have damage to the plantar fascia, or you have plantar fasciitis, which is inflammation of that, it really compromises your ability to properly distribute weight, which can cause ankle problems, knee problems, hip problems, lower back problems, shoulder problems, even headaches, okay? So you really want to make sure that the foot arch is properly maintained. Okay, when we get into the metatarsals, okay, just like the metacarpals, which is the palm of your hand here, your metatarsals, there are 5 of them. They are numbered. Number 1 is your big toe, okay, just like on your hand, it was your thumb. So that is metatarsal number 1, 2, 3, 4, and the pinky toe is number 5, right? So, same basic setup here. Let me fix these toes. As what we saw with the phalanges and the fingers, okay? They are, with the regular toes, there are 3, okay? Proximal, middle, and distal under the nail. The big toe, which is the thumb of your foot, is the exception, where there are only 2, okay? Proximal and distal right there. So if you really wanted to like get fancy about naming this stuff, and I asked you what the name of this bone was right here, you would say that is the proximal phalanx of metatarsal number 3 of, this is a left foot. We're not going to do that. All you would have to do is say proximal phalanx or metatarsal number 3, okay? So make sure you can orient yourself on this, find the big toe. It's a little easier here than it is in the hand because it does look so much more massive than the other ones do. But that's your big toe, proximal and distal. All the rest of them are going to have 3, okay? You have 2 toe knuckles, which is not a phrase that I actually like now that I've spoken it into the universe, right? So that is it for our review of the bones. I hope you guys find this helpful. I hope this covers for some of the stuff you may have missed if you had to quarantine or if you were out for some other reason. Use this to help you prepare for the test. Use that Get Body Smart quiz that I posted there on the Canvas page. And y'all let me know if you have any questions as we go into test number 2.